Hello, friends. Welcome to a special edition being recorded, but not streamed. I am Trevor Stewart 1308, and we are here with a little bear who has a story to tell us about their struggles with health insurance and health insurance companies. Why don't you go ahead and introduce yourself as you would like the viewers to be able to know you?
You can refer to me as a little bit. That's fine.
Okie dokie. Uh, let's start with you have quite a long history of medical problems.
Unfortunately, yes. There, I've had quite a few things crop up over the years.
And that's led you to dealing with a lot of hospitals, doctors, and unfortunately insurance companies as well.
Yes, as it would.
Yes. And now on some background here, I know that you've had struggles with billing, with medical billing here and there. Um it seems like the problems have reached a new apex recently. Um and since we are in the business of naming and shaming, why don't you tell us what your insurance company is? Name them, shame them, and tell us what they're doing wrong.
The insurance company in this case is Aetna.
Etna?
And yeah, and in this case, what's going on is they are, like so many other insurance companies, are thinking that they are in the business of telling the doctors how to do their job and telling them that the prescriptions that they are writing are not what's best for the patient. And in one instance, from my personal experience, one of my specialists had written another prescription for me. It is the same exact medication that I've been on for years. It is an extended release version of the same medication under a different name. Uh, it's the only difference, like I said, is it's just an extended release version of the same medication. And he wrote this this new prescription for the extended release so that I wasn't be taking as much of this medication and wouldn't be building up as high of a tolerance to it and wouldn't be requiring as much of it. Um, it wouldn't have the 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 side effects of taking it long term that people have. The 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 potential side effects, that is the
What are
anyway,
what are some of the side effects?
of of what I had been taking. I'm taking gabapentin, and some of the long term risks are just what I know are that for sure that you can be that you can uh, have accelerated rate of building up a tolerance to it, and
Mm-hmm.
that once that threshold has been reached of the cap where the doctors have decided have the limit of what they have uh, deemed safe,
Mm-hmm.
a safe amount in a day for a person to take without completely ruining their kidneys and liver,
Mm-hmm.
um, then yeah, it just it there's not a whole lot else on the market that's comparable, you know.
Right. And
Uh,
what does the insurance company want you to try instead?
Things that are just again not comparable for one, that have way riskier side effects, um, that have side effects that uh, well, for one, I'm taking the gabapentin for two reasons. I'm taking it for restless leg syndrome, and I'm also now taking it for uh, I'm wanting to say pleural effusion, and that's not right. I'm wanting to take it for I need to take it for um, my words are failing me right now.
That's okay.
I was afraid this was going to happen.
It's no big deal. So in any case, they want to take you off the gabapentin and put you on something that is essentially not
It has
th-
nothing to do with pain relief, which is what it's for. Which
right.
is it's right. It's serotonin. It's a neurotransmitter. It's a not neurotransmitter. It's a it's a pain blocker.
Aha. Okay. Pain blocker. In and they the real nub of the issue here, the real crux of the issue is I think we can get to it with the I believe the most recent time you were in the hospital was for an ulcer, correct?
They found an ulcer. It wasn't. That's not why I was admitted. I was
Oh,
admitted for yeah. I was admitted for nausea and vomiting with blood. In and they the insurance company declined. They denied coverage for that visit because I recovered too quickly.
right,
Because I recovered differently than what they anticipated, than what they expected me to, based on why I was admitted and why I was there,
right.
and and
Now,
how
they
they thought I should have, based on the description of why I was there, and that's ridiculous.
right. It is ridiculous. But while you were there, they found an ulcer.
Yes.
And this ulcer is at the top of your stomach, at the bottom of your esophagus. You know, it's right there at the joint.
Sure.
And what the doctors want to do is give you a colloidal suspension to drink of a essentially of an ulcer medication, or not exactly antacid, but of that. Is that correct?
That is correct. And the medication's called Carafate, and it has
Carafate.
yes, it has a very specific other type of medication in it that coats the lining of the stomach, and in this case also the ulcer, to help allow it to heal.
Right. But the health insurance company wants you to try tablets first.
Which I caved again and said, yeah, fine. I'll you know what, just because I need it so bad, yes, I will try the tablet.
I feel like this is a good example of the type of not helpful logic that the insurance companies are using. You know, I feel like this is an example of how a very textbook example of how the insurance companies feel like they can dictate terms without awareness or attention to the needs of the patients or the intentions of the doctors.
Yes.
And that's kind of the point that I'm trying to make here.
Yeah.
You know, it is. I don't want you to have to relive these awful moments with these. Pardon my excessive language that I'm about to use, but these gosh darned jackaninnies, these poop-brained dunces who know nothing about medicine. And I mean, I'm gonna go out on a limb here and say I would love to see where the insurance companies have medical professionals in their decision-making process. Prove me wrong. But I'm going to go out on a limb and say they do not have the right people in the right places. That they have business people making medical decisions instead of medical people making medical decisions.
I know for a fact that they don't have people there that have ever laid eyes on me in a clinical setting, and I know for a fact that they've never had anybody there that has had the legal allowance to lay eyes on my medical records.
So why should they get to dictate these terms about what drugs you get to use?
Or why should they have the legal right to tell my doctors what they're allowed to use or not.
That is exactly my point.
Yeah.
That is exactly my point. I I do feel I don't have a nice and tidy conclusion for us here. I don't have a nice, easy direction for where this is supposed to go. But I wanted to give you the chance to put out there this evidence, even if it is anecdotal evidence, even if it's just this one case study. I wanted to give you the chance to put that out there, because I know that it isn't just one case study.
See,
That
that's the sad thing. I know it's not just me. That's what.
you represent
Yeah.
a large swath of the population, a large cross section of people are going through some similar fight as you are. And I don't know I don't know how to fix it. I don't know if there is a nice easy fix. I don't know, but I know that if we don't make noise about it, if we don't go saying, "Hey, this here thing is a problem," it won't be
Mm.
addressed. So, all of that being said, the floor is yours for any yelling at these dunderheads you wish to do. If you have an appeal to make, please feel free to take now to make that appeal. If you want to speak directly to them.
Please take your heads out of your butts and do the right thing. My God, these are human lives that you're dealing with and that you're just playing willy nilly with. And I mean, it's not bureaucracy. It's not paper. It's not pen. It's not black and white. It's human lives, and it's not a coin toss. It's not a this or a that, and it's not a Google search anymore, guys. It's really not. Every human body is different, and it reacts differently to different medications. And you cannot just Google search and expect an AI to answer every question. You have got to rely on years of people doing research, and this is what the education is for. This is why people go to med school. This is why people, go to school. This is why the resources have been there. This is insurance companies popped up for the freaking money. That's it. That's all
Preach
there is to it.
on! Preach on! Let
That
her
is there
cook!
is there is absolutely nothing else behind it. It is
It,
money run, and nothing else behind it.
it is business for the sake of business. And when
And
there are lives at stake, that's just disgusting.
it absolutely is. It absolutely is. And the people that these decisions are being made about are the ones that are suffering. They
And
absolutely are.
these people, by the way, these people that the decisions are being made about, these are everyone.
Yeah. They're,
Every
they're
single one of us.
That's what I mean. These
Every
people,
single one
you,
of us.
me, they're the listeners. They're everybody.
Now, there was a moment in our history where we had a favorable interaction with a medical billing system. There was a period of time in our lives where we were covered, medically covered,
Mm-hmm.
both by Obamacare and by the work that Hillary Clinton had done getting hospitals to accept sliding scale payments and, you know, getting hospitals to take into account the the amount of money the patient had, basically. Like,
Mm-hmm.
and you and I both benefited from that through UVA.
Mm-hmm.
And it was an imperfect system. There was a lot of red tape. There was a lot of sort of running around, double checking things. Things have to be done twice. You got to see all kinds of people. There was a whole lot of bureaucracy involved. But at the base level, there were two facts that, in my memory, two facts I can call up, and one is that our health was the goal, our well-being, holistically, our well-being was the goal, and while we may have had to fill out a lot of paperwork for it, ultimately we didn't have to pay for it.
Mm.
Now, the fact that this could exist, that it did exist for a period of time, right? Am
Yeah.
I okay? Let me double check. Would you do
It was
a reality
it was
check
a
on me?
12. Yeah, it was 12 months at a time, if I remember correctly.
Yeah.
We were covered 12 months at a time once you're qualified.
But it was real.
Yes, very real. And we qualified multiple years. I mean, and once you qualified, you only had to they only had to recheck you minimal amounts of
Right.
information.
So why? Why have we gone from that to where you are now?
Because that's financial assistance, and this is insurance. Insurance is completely different. Insurance is
Right.
I almost said bad word.
You're allowed to say bad words. I'm working very hard to not
um,
say bad words myself, but you go ahead and drop all the F bombs you want.
oh, it wasn't. Oh no, it was different bad words. But yeah,
Oh.
thank you. I'm trying to watch my tongue. It was still bad though. Yeah, yeah.
They
Insurance is BS. I'll just abbreviate. You could still get the point from words, from letters, but you can
yeah.
still get my
Um
meaning.
I think what we're trying to say here though is that you know the uh the focus of the system changed from health and well-being to business.
That yeah, I see what you're saying, but yeah, I'm
Yeah.
yeah.
Now.
It came off the people and went to the money, is what I mean.
Bingo.
The focus, yeah, I see what you're
That's
saying, and I agree, and yes, the
and
focus
Disco was
shifted.
his name-o.
Yeah, absolutely, I agree. The focus absolutely shifted, and yeah, it's all about follow the dollar now.
Yep. Yep. And okay, so usually on Tuesdays, my stream is very much about marginalized people, marginalized women specifically, indigenous and black women, and women of color. I don't necessarily think that has had anything to do with this situation. I think that you being a woman has something to do with it. I think that this is a status and class situation, a money
A
thing.
a
I
hundred
think
percent.
I think it's because you don't visibly have more than the absolute bare minimum. Now, I happen to know that while not great, and in fact, I happen to know that you're not out of doors homeless without a job. But you are definitely. Your housing situation is stable, but that is that's sort of a fluke of family and work. Same with your work situation is stable, but that's a fluke of family, much like it is with me. Is that safe to say?
True.
Which basically puts us both financially in the lowest rungs of the socioeconomic ladder. Which means that we have to, when we are dealing with our health issues, we have to go through all of these hoops and red tape, and the insurance companies are going to fight us every step of the way. And I don't have any facts to back this up, but I do wonder what insurance companies will sign off on for wealthier customers. I wonder if there's much like there's a different level of service you get with most services like that. The richer you are, the cheaper things are. I wonder if it's the same in the medical world and with medical insurance. Again, I don't have a nice, tidy conclusion to draw us back to. but I do feel like we've made a couple of points here. Um, is there, now that you have made your appeal, is there any closing thoughts that you have?
I think I'm good. I
All
think
right.
I've done all the damage I can do.
All
Thank you
right.
for letting me speak.
Um, thank you for speaking with us. I appreciate it, and while this wasn't live streamed, this will be on YouTube in some format. I don't think a whole lot of editing it would be necessary. I think you held your own quite well. I might have stuttered and stammered a bit, but so I guess with that, um, thank you for joining us, and as I say, two up, two down, VA double deuces. We're out, y'all.
Right on. Thanks for letting me.
All right, I can hear you again.